Welcome to Prasad's first annual international gathering, Being Together. My name is Vivek Panchapakesan. I am the co-chair of the Prasad Project Board of Trustees and a practicing physician. I am thrilled to be with you today and to share about the work of Prasad. Prasad envisions healthy communities prospering in harmony with the natural environment, where people are inspired to improve the quality of their own and others' lives. To achieve this, Prasad works in partnership with people to benefit families, children, and communities in need, regardless of race or belief, and implements innovative solutions that respond to local conditions and cultures. Prasad recognizes the inherent dignity and worth of each person. Human beings have great virtues, wisdom, and capabilities. Each year, Prasad impacts the lives of thousands of people through Prasad Chikitsa in India, Prasad de Mexico, and Prasad Children's Dental Health Program in the United States. We also have our fundraising licensees in Australia, France, and Spain that support the programs in India. Because we know the most vulnerable people face numerous hardships, and addressing one need at a time is not enough, Prasad takes a holistic approach. Our programming is wide-ranging, simultaneously addressing malnutrition, economic and educational opportunity, and access to clean water, to name a few. Together, our programs weave a net of support, empowering individuals and creating sustainable communities. In the Tansa Valley, access to quality health care is challenging. As a physician, naturally, this concern is close to the heart. At our health center in Ganeshpuri, villagers can access free and subsidized general and specialized care, including HIV and AIDS and tuberculosis prevention and treatment. Our mobile hospital brings healthcare to people in the Tansas Valley's remote villages. Our community development programs include clean water and sanitation, education, women's empowerment, and farming projects. Since 1996, Prasad de Mexico has provided eye exams and performed free eye surgery on more than 35,000 adults and children, restoring their vision, independence, and self-esteem. Our children's dental health program has brought 22 years of happy, healthy smiles to children from low-income families in Sullivan and Ulster counties in upstate New York in the United States. Our mobile dental clinic provides dental care and dental health education to 4,000 children annually. The number of people we help does matter, yet our impact isn't just about numbers. The true measure of impact is the overall difference we can make, the ripple effect. For example, in India, when women are empowered through education, start businesses and earn their own money, they get a voice in the family and in the community. When children have good dental care, it has a positive effect on overall health and self-esteem and helps to ensure good school attendance and performance. Restoring eyesight is life-changing in rural communities, restoring the ability to work and to contribute to family and community, and with that, restoring one's dignity. In 2007, Prasad Project was granted special consultative status with the Economic and Social Council of the United Nations. Prasad has received top scores from charity rating agencies for its commitment to financial transparency, measuring progress and results, and ensuring information is readily available to the public. We are proud to include as partners global corporations and NGOs, local fraternal organizations, governments, and foundations. Prasad programs have received recognition and numerous awards from the World Health Organization, global NGOs like AmeriCares, the New York State Senate, and the Indian government. Thank you for taking the time to learn about Prasad. A few years ago, I was volunteering with Prasad in India and had the opportunity to travel with the mobile hospital. It was one of my first real hands-on experiences into the work of Prasad. We spent the day visiting several villages where countless villagers patiently waited to be seen by the medical teams. In one village, I encountered an elderly gentleman who on this day had brought his young grandson for assessment. The child was severely malnourished, and the medical team quickly began making arrangements for care. As the toddler was being assessed, this elderly man began speaking to me. He had a noticeable disfigurement, missing one eye. He told me this was a deformity he had had from birth. But 30 years ago, he developed a cataract in his only good eye, rendering him essentially blind. Unable to pay for medical care and unable to work, his family experienced significant hardship. He told me, however, how his fortunes changed. In the 1990s, he was a patient at the first Netra Prakash eye camps hosted by Prasad Chikitsa. Through surgery, his vision was restored. He was able to resume working, providing for his family. He continued his story, and with a big smile, reached into his front pocket to show me a laminated card, a keepsake of Prasad that he'd been given so many years ago. He said that he has kept it with him all these years as a reminder that someone had been there to help him when he was most in need. A reminder that someone continues to be there to help with the many challenges he and his family face. I am honored to serve on the Board of Trustees of Prasad, an organization committed to the long-term development and upliftment of communities, and implicitly trusted by the people it serves. This tremendous work is only possible because of supporters and donors like yourselves. This man's story is not unique. There are many more like it. Please help us to continue providing care for those who need it most. Go to www.prasad.org to make a donation today.